Hello everyone, my name is Mary Beth Terrence and I'm here to discuss with you the topic of scoliosis. Have you ever had muscle spasms, back pains, or even shortness of breath? Believe it or not, these are actually common symptoms of scoliosis. Most people who have scoliosis don't even realize it. Today I will be discussing the different types of scoliosis, different symptoms, myths, why women are affected more of scoliosis than men, and my own personal story. Now, what is scoliosis? Well, scoliosis is a curvature in the spine in the shape of an S or a C. There are two different types of scoliosis, structural and non-structural. Now, what is the difference, you may ask? Well, structural is the most common type of scoliosis, and it includes a spinal rotation as well as a curvature from side to side. Now, this type of scoliosis has no known cure, and there's different types of structural scoliosis, such as idiopathic, degenerative, neuromuscular, and congenital scoliosis. Now, non-structural scoliosis is about the same as structural, except it has no spinal rotation, and there's actually a cure for this. It'll later straighten your spine due to age. Now, different symptoms of scoliosis include pain, muscle spasms, shortness of breath, reduced range of motion, different ways you walk, and even a lower self-esteem. And to continue on with the lower self-esteem, there's a lot of other emotional symptoms of scoliosis. Again, scoliosis is a really big emotional journey and can even result in difficulties in relationships as well as emotional problems and lack of self-confidence. Now, there are many scoliosis myths out there. A lot of people think that women who have scoliosis are unable to have children. Now, I can definitely tell you that this is not true. Scoliosis does not affect the birth process. The only thing that it would affect is if you want an epidural, and if you want an epidural, you just tell the nurse ahead of time that you have scoliosis. A second myth is that there are home remedies and cures for scoliosis. I can tell you that this is not true, and there is no cure for scoliosis other than major back surgery. And the final thing is that scoliosis can be prevented. Scoliosis is a deformity, not an illness, and it cannot be prevented, and it cannot be fixed. You can't just not lift stuff to make it stop. It's non-preventable. Now, it's commonly known that scoliosis is more common in women. In fact, it affects women 5 to 10 times more than men. Now, no one really knows why this is the case, but there is a very popular theory on why this is the way it is. And the theory states that there are different types of leptin levels in an individual. Now, when it comes to women with idiopathic scoliosis, their leptin levels can result in an increase of SNS or sympathetic nervous system, and it can also affect their weight, such as lowering their BMI. Now, there are different ways to prevent scoliosis from getting worse, however. Yes, there's no way to prevent it from happening, but there is ways from it to prevent from getting worse. There are 3 different stages of this. The first one is observation of scoliosis, the second is non-operative or bracing, and the third and final one is major back surgery. Now, observation of scoliosis for people who have a curve in between 40 and 45 degrees, or even less than that. Now, for observation of scoliosis, that basically means that all you really have to do is do daily exercise in order for the curvature not to get any worse or get any bigger. Now, the second type of prevention is called non-operative, or how I like to call it, back bracing. And what it does is for people who are a child or adolescent and have a curvature in between 25 and 45, they have to be sized up and have a plastic mold or back brace around them. They tend to wear these for like 3 to 4 years, and it's designed just to help it to where the back will not curve as much as it is anymore, and they'll prevent it from getting worse. However, it's not a cure. A lot of people think that it is, but it's not. It just helps the curvature from not getting any bigger. The third and final type of prevention is back surgery. This is the most major and extreme form of prevention, and this is for people who have a degree over 50 degrees. Now, what people tend to do when they have back surgery is they'll have metal implants or screws or rods on their spine and straighten out the spine. Again, this is the closest to a prevention of having scoliosis and cure to having scoliosis out there. As for myself, I am someone who actually does have idiopathic scoliosis. I got it as a child, and I got it the summer after my 5th grade year. They told me that I needed a back brace since my degree was around 45 degrees. I wore that for 3 years, and then after the 3rd year, they told me to come back the next year and that everything would be fine. Well, as I went back the next year, it turns out that my curvature got worse. I ended up having a curvature degree of 50 degrees. The summer of my ninth grade year, I ended up having to have major back surgery. And with the help and support of my family and friends, I was able to overcome it. And now I actually have a huge scar on my back, from the top of my neck to the bottom of my back. And if I'm going to be honest, I'm very proud of it. It's something that shows me that I went through this and I accomplished something, and that I can go through anything with strength and confidence. After this, I got a lot more confident, I could breathe better, and I just felt better in general. In conclusion, today we talked about the different types of scoliosis, myths and symptoms of scoliosis, why women have a greater chance of having scoliosis than men, and different ways to prevent scoliosis from getting worse. And I want to leave y'all with this last closing thought, and that's that scoliosis is way more common than people interpret it to be. And it's something that people should know more about. Thank you.